how the orthopulse work. For whoever is interested in the biology behind, the near-infrared light emitted by the orthopulse penetrating the gingiva and the mucosa, reaching deep into the bone near the roots of the teeth. So what happened is there's a specific wavelength between 650, 850 nanometers, and that is not absorbed by hemoglobin or water, so it goes straightly deep into the tissue. So once the photons enter in the mitochondria of the cell, they are absorbed by the cytochrome C oxidase, which is a key enzyme in energy production. So what happened, this process normalizes cellular activity, which is critical during orthodontic treatment, right? So when a tooth moves, it creates an injury response in the bone. So one side undergoes bone resorption, like, the osteoclast activity, while the other side must regenerate bone through the osteoblast activity. And this process is pretty energy consuming. So it requires a lot of energy, cellular energy. So orthopulse helps by delivering additional energy by maximize the production of ATP. There's something also helps throughout this process, that there is a release of nitrous oxide, which is a powerful vasodilator, and that enhances blood flow to the treated area. So that does also reduce pain and inflammation and stimulate both osteoclast and osteoblasts, increasing bone remodeling and efficiency. So this is why it's just a powerful process that we go through by every time we use the light, we apply the light to the teeth. So it's what that at the end of the day, what it does, it's going to decrease our treatment time up to 50%, which means less risk of getting burnout from treatment, or reduction of, decalcification risk, or root resorption, or peri-inflammation. It will also decrease the patient discomfort. So some of my patients feels absolutely no pain at all. Like, they're always surprised. I had sometimes phone call of people say, "Are you sure this is working?" Because I don't feel anything. I don't feel the pain. I feel maybe for a few minutes and that's it. So sometimes it's surprising when they compare to experience that their friends had, where they say, "Oh, I had pain for 2 or 3 days, up to a week," and they almost feel nothing. So that sometimes is positively surprising for them. And I see a better tracking. So it's like we see that whatever we implemented in the treatment plan, in the ClinCheck, in the software, in the virtual plan, we can see actually, in the real world. So there is a little bit less of a gap between what happens in the real world and what happens in the virtual world. So whatever the movement that we have planned to implement in a particular case, actually we see more express. When we decrease the number of refinement, of course we have less number of appointments. Even like 2 or 3 appointments will make a bit different for the patient and for your staff. And of course, when you decrease the number of appointments, we increase profitability, which means, the fee per visit. I understand, I'm sure it's not a bad thing, since we're trying to give a gift of smile, but although this price is, the gift of smile is priceless, there is a price of running a business. So if we can, do that give you the same results with the less time, of course, that's something that wonderful.